Yes,
Yes,
sir.
sir. So my name is Hunzla Salim, Dr. Hunzla Salim. I'm a last year medical student and I'm going to perform GIT examination. So he's my patient. May I know your name, please?
My name is Usman.
Okay. May I know your age?
24 years old.
Okay. And I need to do some of your body examinations. So can you please allow me?
Sure, go for it.
So first of all, you have to see the nutritional state of the patient. So for that, can you please sit down in front of the table?
Okay.
May I know your weight? What's your weight? Do you calculate it regularly?
Yeah, I do every week. I'm 83 kg.
83 kg. And what's your height?
6'1", 188 centimeters.
Okay. So why I'm doing this? We have to check for BMI. Okay. So can you please bring your nail forward, hands forward? So we have to check nail sign for any leukemia or something, because in CLD we have leukemia. Can you turn it over?
Okay.
So we have to see the palmar arrhythmia over here. If there is palmar arrhythmia, that is the case of CLD, but it is normal in pregnancy. Can you please tilt your hand?
Okay.
So you have to check for palmar arrhythmia. If there is palmar arrhythmia, that is a case of CLD, but it is normal in pregnancy. So can you bring your nails together for me? You have to check if there is any clubbing in the nails or not. In CLD and inflammatory bowel disease, there is clubbing in the nails. So can you please bring your hands forward and just bend it over? So why I'm doing this, we have to check for flapping tremors due to CO2 retention. Mostly it is in liver failure, chronic cardiac failure, yeah, and then respiratory failure as well. So can you please lie down for me?
Okay.
So first of all, you have to check both the hands, if whether there is any spider nevi or something. Till axilla. Okay. So can you please sit down?
Okay.
Am I allowed to check your cervical? Am I allowed to check your neck?
Yes,
Palpate
please.
your neck. So while I am doing this, we have to check the deep cervical lymph node and also the this one is deep cervical. In parotid gland swelling, because in if the patient is using alcohol, then there is deep cervical lymph node swelling and parotid swelling. Can you please throw a picture? Okay, I'm done. Now can you lie down for me? I have to pull off your shirt, but as there is no black fold, the fold, so we cannot take the patient's shirt off. So we have to just perform it on the above surface of the shirt. So first of all, you have to see the complete abdomen, whether there is any scar, any surgery before, and then as we can see there is no scar, so we should move forward. So am I allowed to press your abdomen?
Yeah.
I'll be giving a gentle press. If you feel any pain, just let me know.
Okay.
So you have to move in the S manner and palpate all the nine divisions of the regions of stomach, starting from abdomen, abdomen wall. Starting from left iliac, and then we have to move to left hypochondrium.
Left ilioinguinal, then left lumbar, left hypochondrial, epigastric,
So it doesn't
umbilical,
do you feel any pain?
hypogastric.
No.
Okay.
Yes?
Then, as we can see, there is no pain on superficial palpation, and we do not palpate any of the organ. So we have to do some deep palpation to check whether there is swelling or some water. Okay, so there is some tenderness or swelling. So I'm going to press it deep. Just let me know if there is any tenderness or pain.
Okay.
The patient doesn't feel the pain as the facial expressions tell. So the next step we are going to see is the percussion for ascites. If there is any fluid in the abdominal space or peritoneal cavity, so we have to percuss it. So how we have to percuss it? We have to tap on our finger throughout the 9 region of the abdominal wall. If you cannot hear the percussion, or you can also do the shift dullness test. That is, you have to place one of your hand to the other side, to the lateral side of the patient abdominal wall, and you have to tap on the right side the wall. If there is shift dullness, that means the fluid will hit your hand and you will feel the resonance. Next, you have to check for the size of the liver. So for checking the size of the liver, we have to again palpate the liver. We have to ask the patient to take a deep breath. Can you breathe in for me?
Sure.
Okay. Next, we have to check for the splenomegaly, if there is swelling of the spleen. Can you please breathe in for me? Take a deep breath, starting from here. Okay. Then we have to percuss the liver and also the spleen, splenic border. From here. Now we have to check for the kidney, if there is any swelling in the kidney, the renal angle as well. So how we have to do it? We have to keep our one hand on the back of the patient, and the other hand we have to palpate it if we feel the kidney on our upper side of the hand. So, the kidney is normal. Then we have to listen to the bowel sound. The normal bowel sound are 15 to 20 seconds per second. 15 to 20 per second. Uh, No, we can hear the bowel sound after every 15 to 20 seconds. So we have to listen to the bowel sound if the bowel sound is absent, but we have to listen on the auscultate on the stat for 2 minutes, because if the bowel sounds are absent, then there might be any obstruction in the stomach, abdominal obstruction might be there. So we have to auscultate to the bowel sound on all the 9 regions of. So the bowel sounds are present. Yes. And could you please sit down for me? We have to check this. We have to check the sacral edema, if there is any sacral edema or not. So how we have to check it? It is called. We have to keep our hand over here for 15 seconds, and then we have to leave it. If the space arises, then it's normal. If it doesn't arise, there might be edema. we're done with this. Can you please lie down for me? Now we have to check for the percussion splash. Means that if the percussion splash is audible for 4 hours after the meal, then there might be delayed gastric emptying. So how we have to check? I'm gonna give a shake to your abdomen. Would that be fine?
Yeah, yeah. Go.
Okay, so we have to shake the abdomen. An audible sound is present. Then after the meal, like if it is after 4 hours having the meal, then there might be any late gastric emptying. So I'm done with. And also we have to check for ankle edema. If ankle edema is present, it is due to hyperalbuminemia. So I'm done with my inspection. So my summary is that I have heard my patient Mohammed Usman. He has normal bowel sound. There is no tenderness. There is no organomegaly. So he's a completely fine patient. So for further investigation, I want to go for CBC and also colonoscopy. Thanks. Yes, sir.
Ready?
ले लो तो मैंने ये करना
Okay.
Thank you.